A Parent's Guide to Child Development. I'm your host, Anna Marie Von Furley from Fledglings Flight. Each podcast, we strive to give parents the tools they need to help their child thrive through conversations with experts in child development and psychology. Today, I'm talking with Ashley Karlin about tips on how to feed your preterm baby. Ashley Karlin is both an international board-certified lactation consultant and licensed occupational therapist with advanced practice in feeding, eating, and swallowing, and certification in neonatal touch and massage. Ashley has supported pediatric patients and their families in the hospital setting, high-risk infant follow-up clinics, in medical model outpatient clinics, and in her own private practice. While she has experience helping healthy newborns and their parents navigate the challenges of breast and bottle feeding, she has also experienced helping premature infants and other children with complex medical diagnoses to breastfeed, bottle feed, and transition to solids. Through her own breastfeeding and motherhood journey, Ashley has learned firsthand that breastfeeding at times does not always come easily or go as planned. Ashley is passionate about partnering with families to meet their lactation and pediatric feeding goals. Welcome, Ashley. I'm excited to talk to you about premature baby feeding tips.
Thank you for having me.
Oh, I'm so excited. So, when we met, it turns out you and I have a very similar mother journey where we both had
Yes.
premature children. So,
Yes.
so you are not only approaching this as an expert in this field, but also from the perspective of a parent of a premature child.
Yes. And I'm actually very grateful for the knowledge that I had before becoming a parent because I felt like I was able to advocate for both my child and myself when we found ourselves in that situation.
Where were you 16 years ago? I could have used you.
I was still in school.
Oh.
Yeah.
Okay, well, let's start off with the basics. When is a
Yeah.
baby considered to be born prematurely?
So a baby is considered preterm if they're born before 37 weeks gestation.
Okay, and how is prematurity categorized?
So those babies that are born between 34 to 36-ish weeks, 37 are considered late preterm. Then there's moderate preterm, which is like 32 to 34 weeks, and very preterm is before 32 weeks. However, I do have to say that even though a baby might fall in a specific category, their lived experience could be very different, not just based on how many weeks gestation they are.
Yeah, one of the things that, I tell people when we're talking about fledglings flight is, for me and our business, one of the things we ask in fledgling flight is whether or not the child was preterm or full term because they can be difference in
Yes.
development. It doesn't have to be, but there can be. And we cut off around 35 weeks. So 34 weeks, and the reason is for what I've been told, and I'm not an expert, is that basically your baby's fully baked in the womb up into that point, and then the last month or so it's just putting on fat. I don't know if that's true or not, but that's how we do it because I feel like kids that are 33 weeks or 34 weeks, sorry, try that again, 35 weeks in gestation when they're born, that there are less likelihood of there being other type of developmental
Yeah.
complications.
Yes, that's absolutely true. I just bring it up because I try to give my child privacy, so I won't talk too much about it. But in my experience, my daughter was 35 and 6, so 35 weeks, 6 days gestation. But she presented so much younger, and what we expected when I found out I was going to deliver her early was not our experience. That's why I bring it up. It just depends on the medical interventions and what each child's individual experiences. But with specific to feeding, assuming that there aren't any greater medical complications, many of those babies are ready to start the feeding process if they're around 35 weeks.
Fabulous. That was going to be my next question is what challenges can parents expect if their baby is born prematurely? And I know that would be different depending on where they are on that scale.
Yeah. So one of the things that we're looking for is suck, swallow, breathe coordination or their ability to do that. So babies are already swallowing amniotic fluid in the womb, but once they're in the extrauterine environment after they're born, now they also have to breathe. So for the babies that are born before 32 weeks, they do not usually have a well-established suck, swallow, breathe coordination. So that can make feeding by mouth really challenging. And they just need time to learn. So the 34 to 37 week babies, those are like the late preterm babies, they might have the suck, swallow, breathe coordination. And feeding can sometimes still be a little bit difficult because they don't necessarily have the reserve to be able to feed well. So they might be able to feed, but for some of those babies, they might still need a little bit of support or another means to get their nutrition.
Right. Yeah. My son, 33 weeks and 5 days is when
Yeah.
he was harvested. And yeah, he had a garage tube in the NICU.
Yeah.
And they did put my what little breast milk that I made, and we can come to that issue too.
Yeah.
Of it is in his garage too, but then they did try to encourage also breastfeeding as well. But he was a 4 pound little nugget. And I don't know that he he really had it down at that time. So neither of us were prepared for each
For the
other at the
experience.
time that he came. So
And that is common. Very few parents know in advance or expect that they're going to have the experience of being in the NICU. So that's a whole other thing of being able to cope with that experience and then be ready to take on the role of parent and whatever you're expecting your body to do.
right. Yeah, when my son came, we we didn't have his room ready. We hadn't
Yeah.
even had the baby shower. Like we were like really, really unprepared.
My favorite story, my husband, when I delivered my baby preterm, I called him and I was like, you need to get to the hospital right now. And we hadn't packed anything either. The only thing he brought me was nipple cream. That was it. It was so
Well,
fun.
we didn't even come with that when I went to the hospital. We didn't have anything packed either. I went there in my pajamas, so and stayed for 10 days. Okay, so back on track.
Yes.
So how is feeding a preterm infant different than a full-term infant?
So the preterm infant, I kind of mentioned this earlier, but they're processing being in the world in the extrauterine environment, and their body may not be ready for that. So just the demands of breathing can be more challenging. Managing their temperature, managing their blood sugar, all of those things. So if you think about it, if those are the baseline things that we need to do, feeding is a huge challenge for some of these kiddos. So sometimes, you were mentioning this before, Anna Marie, how sometimes they're not able to eat entirely by mouth yet. So they might have like a feeding tube that goes through their nose or through their mouth to help with nutrition. They might need like specific positioning to help their feeding be more successful. Other things, because I was mentioning, it's just harder to exist. Sometimes they need more calories than a typical baby. So the kind of food that they might need would be different. And then also their tummies are so little, so they might need nutrition more often. Those are some of the things that come to the top of my mind.
Are there things that a parent can do to improve oral feeding with their baby while they're in the NICU, the neonatal intensive care unit?
Yeah. So the first thing I would say is, with every stable baby, skin to skin is going to be one of your greatest tools. Babies want to be in close proximity. It's going to keep them warm. If a parent is wanting to specifically breastfeed, it's really nice for their chest to be a happy, comfortable, safe place for the baby. So if the baby could be there while the feedings are running, let's say we're talking about a baby who isn't yet ready to feed by mouth, but they're there, they're close to the food source, they smell the food source, they're there while their feedings that are going through the feeding tube are running, that could be helpful. If they're able to either suckle at the breast, even if they're not transferring milk, or suck on a pacifier, so that there's that correlation, like, oh, I'm sucking and my tummy is getting full. That could be another great skill to work on. Other things to support feeding as a caregiver, we can, because as the role of occupational therapist, we look at feeding as what we would call a co-occupation. A baby's not doing it on their own. There's a partner involved, the feeding parent. So what we can do is really respect their cues. So paying attention, is my baby looking like they want to suck right now, or are they not, and not ever trying to force feed the baby. Those are some of the things.
Interesting. So we kind of brought this up before, but
Yeah.
can a preterm infant breastfeed?
Yeah, they absolutely can. Um, they Parents are already producing colostrum well before the age that we expect babies to be born. So from the parent perspective, there should be at least some of that nutrition available. The baby is going to help the parent bring in their milk supply, and it's a learning process. So sometimes it might just be practicing the sucking, like it's almost non-nutritive, but they're there practicing the skills of sucking. Um, and in some cases, breastfeeding is actually easier for the babies than bottle feeding. It just depends on the situation. And you might hear me say that a lot when you ask questions, because there's no specific formula. It's going to be very dependent on the individual family and the baby.
Yeah, it's true. Every child develops differently, for sure. You could have 10 babies that were all born at the same weeks of gestation. They're all going to have different journeys.
Experiences, yeah.
So what challenges what challenges can a preterm baby have with breastfeeding?
So with breastfeeding specifically, again, there's like the dyad experience, the mom and baby together, and then the individual experiences. So for the baby specifically, they might not have developed that suck, swallow, breathe coordination yet, or even the sucking reflex could be impaired. Sometimes it's the fatigue that I was talking about. They might want to try, but they just don't have the endurance to successfully get full, or even the strength to adequately remove the milk from the breast.
Mhm, mhm.
Um, there could be, and then on the parent side of it, sometimes there could be milk supply challenges. So maybe the baby is actively sucking, but the milk supply is still increasing in volume, is what I like to say. So they might still need another means to actually get their full feeds. And then the nutritional needs. So sometimes they just need a little bit extra or more calories or another means of nutrition to help them adequately grow during that time period. Um, those are the main ones that come to mind. Oh,
Yeah.
obviously, if they have any medical, like underlying medical challenges that might make either the positioning or even being out of their NICU bed. Sometimes there are limitations that they have to stay under bilirubin lights, or other reasons that they might need to be there. Respiratory needs, maybe the amount of respiratory support that they need isn't agreeable with feeding yet by mouth.
Yeah, I think children that are born, I don't remember what the cutoff is, but the lungs develop in utero up to a certain number of weeks. If children are born too early before the lungs are able to be developed, then they can be put on a respirator and
Yes.
NICU as well. I know that at 34 weeks, the hospital that I gave birth at was going to allow me to go ahead and deliver, even though my water had broke at 33 weeks. But they gave 2 doses of steroids to me to help
Yes.
the lungs finish developing my son, and then they were gonna let him ride. Again, one of the challenges we had as a little 4-pound nugget is that he burned more calories trying to breastfeed than he was
Mm-hmm.
getting out, and yeah, and my milk hadn't really come in yet, so I didn't have a whole lot to give him. That is a lovely transition to the next question is what challenges can a new mom have with breastfeeding their preterm baby besides their milk not being in?
Um, what, sorry, what are some
What
of the challenges?
challenges can a new mom have with
Well, the
breastfeeding?
baby might not be able to latch yet well, so they might not efficiently remove all the milk. So a lot of times we see parents that have to do what we call triple feeding, which is the baby latches and they're pumping and they're bottle feeding or syringe feeding or whatever the other method is to get the baby to have enough milk. As we mentioned before, a lot of parents are not expecting this experience. So the maternal anxiety and stress can absolutely impact milk supply, having access, even, in my experience in the NICUs that I've worked in, sometimes our families are traveling a far distance once the parent has been discharged. So even like, how am I going to get in the number of pumps that I need to in a day to maintain this milk supply that I'm trying to establish for my baby can be a challenge. And then sometimes it's just asking for what you need and advocating for what's going to be best for your family.
Yeah. I definitely was a triple feeder for sure.
Yeah.
It is exhausting.
It is exhausting. And I tell my clients all the time, like it's a great way to get to your end goal, but it is not a sustainable long-term plan. So hopefully it's a bridge to getting you to where your family wants to be.
Yeah. So is it safe to feed a preterm baby with both formula and breast milk?
That is such a loaded question. um, you know, I mean, people have different beliefs about feeding for their babies and what their desire would be for the food source. So I would say it's so important to have open conversations if you're in the NICU setting with your medical team about what your family's goals are and what you imagined for your baby. There are absolutely times, like I mentioned before, that a baby just needs extra calories. So that might be fortifying. So it could be fortifying mom's breast milk. Some hospitals have access to donor milk, and some babies need specific formulas or other means of nutrition for specific reasons. If we're talking about like, would that impact a baby's breastfeeding experience later on? I've absolutely seen families that were able to go from what was medically necessary in the NICU to then getting to exclusively breast milk if that was their desire.
Yeah, my son wouldn't have survived if we didn't use formula in addition to because my milk really wasn't fully in until he was 6 months old. So
Yeah, and like I mentioned, it's like depending on where you are in the world or in the country or in the state, different NICUs just have different things that they're ready, right? So in my experience, we have access to human donor milk, but that's not always the case. And there's specific guidelines about which babies are even appropriate for that.
and here's like another hot question, and it's always debated amongst a lot of mommy influencers like talking about this topic.
Yeah.
We want to get an expert's opinion here. Like, is it okay to alternate feeding a preterm baby between breast and bottle?
Yes. Yes, it is okay. Again, I'm going to say what the family gets to make that decision alongside their medical team, but it's absolutely possible for babies to successfully be able to breast and bottle feed. And working with your feeding specialist in the hospital, with the lactation consultants, they can help you determine for your specific situation what bottle, what position, what flow rate is going to best suit that specific dyad. Again, it depends, but in many situations, it's like put the baby on the side in a side lying position, similar swallowing to at the breast, a very, very slow flow nipple. And we can successfully get the babies going back and forth. Or there are instances where sometimes the babies require both in one feeding.
Mhm,
I
mhm.
mean, the most important thing in those early days is to make sure that the baby is growing and developing, and that if it's a parent that wants to breastfeed, that we're helping manage the milk supply.
Fantastic. So what tips do you have for new moms who have trouble getting their baby to latch properly, which was me. My son definitely was did not take to it naturally. I ended up having to hire a lactation consultant myself.
Yeah. So with the answer to many things with preterm babies is going to be skin to skin. Do a lot of skin to skin so that the baby is in close proximity to the breast, can smell the breast. A lot of times these babies, they're just not as strong and they don't have as much reserve. So we might need to be more of a part of the latching process. Have I seen a baby just reach over and latch? Yes, but a lot of times they just need more support from the parent. Good positioning where they're really well supported, both the baby and the parent. Sometimes it's even shaping the nipple, like compressing the breast tissue so that when the baby opens their mouth wide, which is going to be smaller than a full term baby, that we're getting more of the breast tissue on there. And then also making sure we're capturing that moment where their mouth is nice and wide open and bringing them really quickly. And then the other thing is back to going by the baby's cues. Sometimes we, the parent, are like, this is the time we're gonna breastfeed. And the baby's like, this is the time I'm going to sleep. So trying to capitalize on the times when the babies do seem the most awake and alert and ready for learning so that their experience is positive.
Yes. Yeah, you don't want to give them anxiety related to feeding.
Yeah.
What tips do you have for new moms who are having trouble getting their baby to latch properly? I think you kind of already
Yeah.
covered that. Do you have any recommendations for a new mom whose milk hasn't come in yet, who wants to breastfeed for her preterm baby?
Yeah. I would say the first thing is be kind to yourself. It can be a process and it's oftentimes earlier than you're expecting to have your baby. Again, I'm going to go back to lots of skin to skin time as much as possible. Um, Different tips, like if you're with your baby or not with your baby. If you happen to be discharged from the hospital and you're at home and you're pumping, if you can bring something that smells like your baby home with you, or if you have videos of your baby that you can watch or sounds of them crying, sometimes that can help. Um, Creating an environment that feels like as peaceful and calm as possible can also help. I would say make sure that you work with the providers either in the hospital or if you have a private lactation consultant to give you sort of like a schedule, educate you on what would be the best for your situation. How many times a day do I need to remove milk? Um, Calling on your community. I can't believe I haven't said this yet. In general, when you have a preterm infant, if you have a community to surround you and remove other responsibilities so that you can be more relaxed and focus on what you're doing, that also helps. So maybe it's somebody who helps to make sure you are eating and drinking enough. Maybe it's somebody to wash your pump parts and the bottle parts for you. So that's one less thing that you have to do. And when you work with your provider, you can get initially the textbook answer, like how many times should I remove milk during the day? And then also talk about the reality of your situation so that the plan that you have is not another added stressor. It has to be reasonable and something that you can carry out.
Yeah, yeah. I mean, my pumping schedule was crazy time. It's like every 90 minutes, which meant I got no sleep. Because
Yeah.
by the time I clean, like, and it was 90 minutes, not from when I stopped pumping, but from when I began.
When you start, it's just like how we assess when how often is your baby eating. It's from the start of the feeding, not the
Yeah.
ending.
And
Yeah.
between, like washing the bits and then putting things into the freezer, like I had 20 minutes before I had to start all over again. So
That's so hard.
It was really hard, which also is a great segue to how do you recommend a new mom who may be recovering from a challenging and unexpected
Yeah.
preterm birth manage to
Yeah.
recuperate while trying to pump and breastfeed their baby, which is all.
I think
You
some
can
of the things
tell
are going to be
these are
similar.
self-serving questions.
Yeah.
I mean, by my experience.
I feel like some of it's going to be the same as what I was saying above, but definitely if you have a village to call upon, ask for help. Hopefully you have the kind of village that's also going to offer, so you don't feel like you have to ask. Delegating out tasks like cooking. If you're home, let's say you're home with your preterm infant, maybe somebody else is cooking and cleaning or even doing the diaper changes for you or rocking the baby back to sleep in between the feedings so you have more downtime. So in the intro, you're mentioning I'm a lactation consultant, also an OT. So as an OT, we look at routines and activity demands, and we help families figure out how to set up their day so it's more efficient. I'm always telling clients, like, I want to help you meet your goals and I want to help you have more time in your day. So let's figure out what we can not even offload, but how we can do things in a more effective way. So like, for example, if you're pumping, are you having to walk upstairs every single time that you have to pump? Maybe we can move the pump to a place where you do other activities too, so you're not taxing your body so much. Making sure that your snacks and your water and things are right there also, so you're not having to get up and down, because a lot of preterm babies are also born by cesarean section. And that's a whole other process for parents to recover from. And then trying to find time to do things that bring you joy while you're recovering. So even if it's like listening to a podcast like this one, no, or listening to your favorite music or calling your friend, whatever it might be, so that you have time for yourself.
Yeah, it was challenging for me. I had I ended up being in the hospital for 7 days after my son was harvested. He was
Mm-hmm.
there for 12 days, but because he was cesarean, I couldn't drive. So I was really reliant
On
on
others.
somebody driving me to the NICU. So I did not get to spend as much time with him when he was in the NICU because I was
Yeah.
driving and I had no way of
You
transporting.
mean once you were discharged?
Once I
Yeah.
was discharged, yeah. So
Yeah.
that was hard too because I would have liked to have been there more, but my husband was working full time and I had to wait for him to get off work in order to
Yeah.
get over there. And then we were only there, visiting hours were, shorter. So I could only stay for an hour or two, which was a real, one of the things that's really hard about being a preterm parent is that, you go to the hospitals. I was doing all these different birthing classes and whatnot, and you see the women leaving and their wheelchair holding their babies.
Mm-hmm.
And then I left in a wheelchair without my baby, and that felt really weird. And then going home with having had the birth experience without my baby for
Yes.
some time,
I
like that is really challenging.
I remember that experience too, because we had the car seat in the car already, and how like sad that was. And my sisters came to visit, and I had to have a C-section, and they were trying to lift my spirits by being funny, but then I was like, please don't make me laugh like that. That hurts so badly. But yeah, it's so many feelings. And I worked in the NICU before I had my own baby, but having that experience really kind of changed my mindset. Not necessarily that the way I would recommend feeding a baby is going to be different, but really taking into perspective what the family is going through and what capacity do they have right now to even like learn what I'm trying to teach them, or do they just need like somebody to listen to them right now? You know what I mean? Just
Yeah,
to make sure that it's such a complicated situation.
it's it
Yeah.
is. Okay, so this is another one that I came up with because it's from experience. So in the NICU,
Yes.
I only had a single child, but the people across from me had three,
Yes.
three babies. So sometimes babies are born prematurely because they are multiples. Do you have
Yes.
tips for family with twins, triplets, or God forbid, more than three babies?
So I'm going to go back to asking your village to support you. But the other thing is, initially in the NICU setting, babies are usually on a schedule for feeding. If possible, I would say trying to practice what the real home life experience is while you're in this really supportive environment where other people can be helping you and working out the kinks. Some people are able to figure out how to feed two babies at the same time, which is amazing. Also, this might be a situation where, for the sake of the family's overall health and mental well-being, a parent chooses that they might breast and bottle feed, kind of taking turns. That would be one suggestion. And then just, there's no perfect feeding scenario. It has to be what is going to be best for your family. So that would be the other thing. And then from the milk supply perspective, right now you have to produce enough for 3 babies if you have 3 babies. So working closely with your provider to make sure that you're meeting what your goal is and taking care of your own body.
Yeah. What I witnessed was like feed, 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 diaper, 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 feed, 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 diaper,
Yeah.
diaper. Like, wow, the person that, I don't know if it was a caregiver or it was the mom, but they never got out of that chair because it was just, that was the cycle.
Yeah, and it's tricky because we're always telling parents, feed on demand, which is great in an ideal situation. But sometimes it has to be, I always keep away from saying schedule, but more of like an understood routine so
Yeah.
that you're meeting everybody's needs. Because if a parent isn't able to get any downtime and take care of themselves, even their basic needs, like go to the bathroom, take a shower, those kinds of things, like how are they going to care for their babies long term? We have adrenaline in the short term, but I mean like sustain that over time.
Yeah, my sanctuary was the shower because
Yes.
nobody could ask me
Yes.
because I was in the shower. All right, so now I have a question about my favorite topic, which is primitive reflexes. And anybody who's watched any of our podcasts knows or has met me or done met me at Prego Expo. This is one of my soapbox moments because I feel like primitive reflexes are the most important thing nobody knows about. So this is this is for me. This question
They
for
help us to survive in life.
I know, right? Nobody knows
Yeah.
this. Okay, so my question is, primitive reflexes are the reflexes that begin when your baby's in your womb. They are automatic physical reactions triggered by stimuli when activated. They help your baby stay alive until they learn to operate their body themselves.
Yes.
3 of them are related to eating: the rooting reflex, the sucking reflex, and the babkin reflex. Can you explain what each of these reflexes are?
Yes. So the rooting reflex, you were saying, born with it, starts in utero. Well, it kicks in right at birth. So if you touch the baby's cheek, you'll see them start turning their head side to side and opening like they're looking for their food source. So this one is really important because it's going to help them find their food source. It's also a tool that we can use for those preterm babies that are maybe really sleepy to help them to latch on. It also gives us information about how the baby is doing neurologically. So during our assessments, whether it's in the hospital or in the clinic or whatever it is, we're often assessing the baby's reflexes because sometimes there are other things going on that aren't the reason that the baby came to us, whatever that might be. So it's going to help them find their food source, and it should integrate around 4 to 6 months. And then you might ask me what would happen if it didn't integrate, but I'm thinking like moving forward at 4 to 6 months. So before that, we're primarily breast bottle feeding. But once we start to eat solids, that might get in the way if our head is turning all over, being able to stay stable, get food in our mouth, chew, swallow, all of those things.
So what about the sucking reflex?
So the sucking reflex that comes up so much in my practice. So babies are born, if something goes in their mouth, the reflex is that they would naturally start sucking. So related to feeding preterm infants, babies have a high need to suck when they're first born. So hopefully this reflex is intact and it helps bring in mom's milk supply, it helps them eat and all of that. It's when something touches the roof of their mouth and it helps them basically figure out how to eat. Some babies might have a diminished reflex. So you might notice that you are trying to elicit a suck and that's not happening. And that could be that they're actually not sensing it. Sometimes the anatomy makes us think initially that there's not a reflex, but we might not actually be stimulating it because the palate is really high. And the sucking reflex comes up a lot in feeding because at a certain point, it is supposed to integrate, which is like 4 to 6 months, which can actually sometimes be a challenge for families who haven't yet introduced a bottle. If they're trying to introduce a bottle now, and that's now a learned skill versus a reflex, sometimes we have difficulty getting those babies to transition to bottles.
Interesting. All right, what about the babkin reflex?
So the babkin reflex. So this is the one that sometimes gets in the way of breastfeeding. It's helpful. So if the babies are latching, sometimes you'll see they're like, it almost can look like they're frantically bringing their hands to their mouth and they might bat the breast out of the way. But the other thing is that this is a way for us to know that babies are hungry too, bringing their hands to their mouth and then they're rooting.
Fantastic. So these reflexes should get replaced by intentional movements as your baby learns to operate and open their mouth by choice, suck when they want to, as well as bring into their mouth in order to help with self-feeding later. Can you briefly talk about what happens if these reflexes are retained? I think you talked a little bit about it with was it the rooting reflex can be a challenge if it doesn't retain, or if it's retained after 6 months.
Yeah, so then they might be responding to they might not be able to develop the skills to open their mouth when food is coming toward their mouth. They might turn away from it because it touches the side of their mouth. Sucking, if something is like food is stimulating their palate, right, and then they're going to start sucking, when what we actually want them to do is dissociate their tongue and move the food to the side and be able to chew it, prepare what we would call a bolus, which is like a ball of food, move it back and be able to swallow it. But that might get in the way. Are you still on there? Sorry, something popped up on my screen for a second.
Nope, totally here.
Okay.
All right.
Yeah, so that could get in the way of that. And then also, if we're trying to reach for a spoon and bring it to our mouth, that might be impacted too.
So are premature babies more likely to have retained reflexes?
They are. So I was talking a bit before about the experience of being in the NICU. And when babies are born and they're full term and they're not in a medical environment, they get a different lived experience than the babies that are in the hospital setting. So it's through experience and movement and touch and lots of experiences over time of those movements that help to integrate the reflexes. So if you think about a baby that's maybe in an incubator instead of on a parent's chest, or just the different kinds of medical intervention and touch that are absolutely necessary, right, for survival, it can impact the experiences needed to integrate those reflexes at the expected time.
Yeah, and some of them, not the 3 that we've discussed, but some of them are actually integrated by going down the birth canal. And if you have a cesarean section, then that trigger, that shut off point doesn't happen. So I know from experience that as a baby born by cesarean,
Yes.
that can be an issue as well.
Yeah. It's really not just the reflexes, also just how the sensory system is primed in general from the way that a baby is delivered. But with all of that being said, if a baby is struggling, there are a lot of supports available. Oftentimes they start in the hospital, and then also there's a lot of early intervention, private practice folks that can help parents determine what might be the underlying cause and help support them. Um, and parents will typically have an idea if there's something that's going on because they're the experts on their baby.
So how can a parent tell if their baby has a retained reflex and what they should and when should they seek the help of their pediatrician or specialist?
So sometimes it might just be as simple as like feeding is really hard. And that might be the first clue that they have that they're having a harder time doing the everyday activities than they were expecting. I think because parents spend the most time with their babies, anytime that you have something that you're concerned about, you should bring it to your pediatrician right away because it's much easier to intervene earlier and address the issue.
Fantastic. So do you have any final tips for families who have preterm babies?
Yeah, I would say the couple things I like every family to know, I just mentioned it. Number one, you are the expert on your baby. So even in the hospital setting, right? Like other people are supporting you. You're spending, hopefully, if you can, a lot of time with your baby day in and day out. You are a constant. So if there's something that you notice, feel empowered to share it. Um, Number two, I would say I mentioned a village a lot of times, but also seeking community with other people who have a similar lived experience to you, even if it's, their baby was born at a different number of weeks gestation. It's nice to know that you're not alone. And it's nice to be able to share stories with other people with a similar experience, but are a little bit outside of your family unit if possible. The third thing I would say is a lot of babies thrive and do amazing. And if you have concerns, there is a lot of support available. So just make sure that you ask for it. And the fifth I would say is you can do this. You are the perfect parent for your baby.
Fantastic. It was such a wonderful, informative conversation that I needed
Thank you.
years ago. And so going forward, it will help people moving forward instead of those of us who needed it a long time ago. How can people get in touch with you?
So I'm in Los Angeles. I'm
Yay.
based in Los Angeles. I have an office in the city of Calabasas. I also have a website, www.familytree.com. You could reach me that way. And then I also have Instagram and Facebook. And you would think I would know my handles by heart. I think it's Family Tree OT and Lactation.
Fantastic. Well, thank you for your time today and
Thank
for
you.
the conversation.
Thank you for having me.